Hi, and welcome to Coffee with Claire. You know, growing up, my dad used to have this saying that drove me crazy. Whenever I would ask him for something that everyone else already had, he'd look at me and he'd say Shug, because that was my nickname from him, Shug. If everybody jumped off a cliff, would you jump off that same cliff? And I'd always say, well, no. And he'd say, well, just because everybody else is doing the same thing doesn't mean you have to do that exact same thing. And now that I look back on it, I think that that really helped me frame how I look at things and choose different perspectives, because my dad coached me along to say, you know, you don't have to conform. You don't have to go with the flow. And when you think about how entrepreneurs think and feel about things, that's kind of the attitude they bring to the table as well. So my challenge for you this week is to think about how you are approaching things. Are you doing things exactly the way they've always been done? If so, why? Is there a better way to do it? Think about it. Let us know how it works out for you at Coffee with Claire on our Facebook page, and we'll talk about it. As you know, each week we interview entrepreneurs, people who give back to the community, and people who like to have fun. And this week, please help me welcome Dr. Aman, owner of Restore Center for Integrative Medicine. Woo woo! Dr. Aman's in the house. So Dr. Aman is board certified by the American Board of Internal Medicine and a fellow of Integrative Medicine at the Arizona Center for Integrative Medicine. Her passion for prevention began prior to attending medical school, during her years conducting research at the Centers for Disease Control and Prevention, or the CDC, as well as Vanderbilt University Department of Preventative Medicine. Most recently, Dr. Aman served as Assistant Professor of Internal Medicine in the Division of Hospital Medicine at UT Southwestern Medical Center. Her professional and personal journey inspired her to establish Restore Center for Integrative Medicine, which combines the best of Western medicine with evidence-based complementary therapies to heal and prevent disease. Dr. Aman and her team are committed to providing holistic and patient-centered care that addresses all influences on a patient's health while placing the focus on true healing and improving quality of life. Wow, I love that.
Thank you.
I love that you're integrating Western and Eastern medicine and taking the best of every possible world to get the very best outcome for each of your patients.
Exactly.
And you take a look at your patients individually, right?
Yes.
You know, it's not like they all come in at one time and say, okay, check, check, check. It's like, okay, we're going to take a look at this one and this one. So is that kind of what integrative medicine is all about?
Yes,
okay.
definitely.
So tell us about that.
The basic definition is that integrative medicine is the combination of the best of Western medicine with evidence-based complementary therapies. And so these are complementary therapies that are carefully selected, and studies have shown that they're not only safe, but they're effective. So just as you explained, we combine the best of both. Integrative medicine also is very novel in the idea that it's patient-centered, it's holistic. We want to, as you said, recognize all of the influences on an individual's health: nutrition, sleep, community, relationships, stress. There's so much more than just the symptoms, and it's very important to look at all of it.
And you have been doing this in your head for a long time. So what inspired you to physically establish Restore Center for Integrative Medicine?
I had two big inspirations, I would say. The first was my father, who was an internist and probably one of the earliest integrative doctors I have met before that term was coined. He had essential oils in the house, he had supplements, he had herbs, he had an infrared sauna, and all of these new devices where we would just kind of scratch our heads and see a new box at the front door and wonder what's in that, right? And see him, you know, mixing his powders and all of this. So it was very intriguing and interesting. And when I became a believer was when he recommended essential oil for my son's infantile eczema.
Oh,
He
okay.
said, try this first, and within 3 days it was gone. I mean, it vanished.
Wow.
And I avoided steroid creams. I avoided so much else that could have irritated and caused side effects. And it was just I think a moment where my understanding of complementary medicine changed. My patients were my other great inspiration. And that is because I saw in taking care of them what was missing, what I wasn't addressing. The healing aspect of my care for them was really lacking. I had to assess them as a list of symptoms, and I had to just address those symptoms with basically medication. There was no other alternative. And I couldn't really pay attention to the person behind those symptoms and what else was influencing their health. So it was also, I would say, my love of prevention that I was also missing, because true preventive care, we could see that these were patients suffering from chronic preventable diseases, late complications of these diseases, and that was remarkable to me, that in this day and age we're still, not getting to the degree of prevention that's required.
Yeah.
And younger patients suffering more and more preventable disease. So putting all that together, my inspirations, what was missing, my passion for prevention, for taking care of patients in a holistic way, really propelled me to think of a place that I could provide all of those things to my patients. And so at Restore, it's not just me, it is also, we have an acupuncturist, we have a licensed professional counselor, we have a dietitian, an exercise physiologist, a neuromuscular massage therapist,
Wow.
and an oncology and lymphatic drainage massage therapist. So I just thought of what are all of the aspects that I would want to bring in, the expertise that I would want to bring in, the things that I, as an integrative fellow, have experience with, but not to the degree that a master's level individual would have. And plus, having such a great team, you can really address so much and work together to take care of very complex cases, which as a physician before I would shy away from because it would be so challenging. Well, now you have so many hands on deck and you have so much experience to utilize to help people. It is a phenomenal experience.
And I love that you are looking at them as a person. I mean, when you're little and you think about, doctors and nurses, you think, okay, well, they're like real caring people and they really want to make sure that I'm okay. And then you get into the health system and you feel like you're just a number. And so with what you're doing, it's like you can let down your guard and people probably share a lot more information with you just because they feel like you care.
Yes.
I'm not just a piece of paper or a check mark on some kind of spreadsheet.
Yes, that's very true. The human element returns, the healing process returns. So much comes back to the relationship between patient and provider, and that is another feature of integrative medicine, the therapeutic relationship that exists. And that's really the foundation. I say that, and now there's a greater understanding that the provider has to have a healing intention when they care for somebody. And I find that really interesting, but so true. If your doctor really believes and really has that intention for you to get well, I think that is a better relationship to have with your provider.
Well, yeah. I mean, just think about the energy exchange.
Right.
That I want you to get better,
Yes.
and it's not you're not bothering me.
Yes.
I care.
Yes.
So what makes Restore different than some of the other integrative practices that we see that are popping up all over the United States?
I think there's two things that set us apart. The first is the combination of services that we have. Those are fairly unique. Fitness was a very important piece for me to bring into the clinic. I know that, usually through your doctor you may get some advice to exercise. That's, of course, very critical in our therapeutic plans for patients. But how much to exercise, what kind of exercise, what's safe to do. If somebody has been sedentary for 10, 20, 30 years and you want them to be active, how to guide them to do that.
Yeah, safely.
Yes,
to where
exactly.
they don't go out and create another health problem by trying to, be healthy by exercising.
Yes, very true. You need to give very clear guidance, and most importantly, you need to give support. And that's what the team does, is you have a member, you have several members of your team just available to you to help give you that clear guidance on what to do next.
Right.
And the goal is to give you the lessons that you need, but then you're going to be independent. Then you're going to take that information because you've learned it properly, you've learned it thoroughly and clearly, and now you won't need us anymore.
So what about those people that are already kind of healthy? I mean, can they come to Restore and just hang out? I mean, it sounds like a fabulous place just to go.
Yes, absolutely. That is the preventive piece that that drove my passion, one of the main things towards establishing the center. And that's because, as I had mentioned, I recognized that prevention was still lacking. Why were these people slipping through, our fingers and still developing these late complications of things that we know how to treat, we know how to improve? And the statistics actually are quite staggering. Of the 800,000 people a year who suffer a heart attack, 50% of those people have a normal cholesterol. And we are taught that that is one of the pivotal factors of risk.
Okay.
Well, it can be, but then there's 50% who don't have that as a risk factor. And in fact, 10 to 20% of these same individuals don't have any of the traditional risk factors, which we are trained as physicians to look for. Those include high blood pressure, obesity, family history, smoking. So 10 to 20% of people who have a heart attack don't have those risk factors. That's fascinating and concerning. And so those statistics are what led us to look for more sensitive tests to detect those who are at risk. And we have wonderful tests available to us now that look at, for example, your cholesterol particle size and density and number, because we know that that is now more important than just your LDL score, which we traditionally look at. So although the data doesn't say that we should use this in a widespread way, we should use these tests for people who, for example, have had maybe a cardiac event and had no risk factor, and also for people who have a very strong family history and they're very anxious and they want to know really what is their measure of risk. But I find that this test can improve people's motivation to make lifestyle change, even if they don't have one of these two situations. The other preventive piece, which I really feel so strongly about, is, as I mentioned, fitness. We have known for a long time that cardiorespiratory fitness is a direct correlation with mortality, meaning it's an independent predictor of mortality. If you take two individuals that have the same level of blood sugar, blood pressure, the same weight, but one has a increased respiratory fitness than the other, they will live longer.
Wow.
So we've known this for so long, but we had no way to measure it. We really didn't put that into any perspective. We just said, well, we want people to be aerobically fit. What does that mean for people?
Yeah, what does that mean?
Exactly. So I did my own testing, in fact.
Okay.
I got on a treadmill. I did a stress test.
Oh, so you did the testing on yourself.
I did. I had all the EKG leads on. And we have seen this test when we are ruling someone out for heart disease. But this test can be used years before you get to that point.
Oh, that's fabulous.
Exactly. To measure your heart rate max, your maximum heart rate at peak exercise. Based on that number, then we can develop an exercise regimen for you that takes you to a heart rate that's a percentage of that maximum.
Okay.
And slowly build you up from there so you are getting fit in the sense of being cardiorespiratory, having that cardiorespiratory fitness that I talked about, CRF. So we do that in the clinic, and it's just so informative for patients, as it was for me myself,
Sure.
to then structure my exercise regimen around that. And one other component of prevention that's so important is going away now from the body mass index,
Okay.
which is a measure of your weight for your height. Now that's better than what we used to have, but I think that there's even newer measures, and one of those is your body composition analysis.
Okay.
What we know now is being more important is to know your percent fat versus lean muscle. People can have a seemingly healthy weight, but they have very little fat, very little muscle. This is actually dangerous. So you don't want to rest easy and say, my weight is okay, because you're still at risk with this increased level of fat.
Right. So, I love that you're coaching people on, how they're already good and get better,
Yes.
or if they've got a situation that there's a way to get better and stay better.
Yes.
To really inform the whole body. I'm not just working on your eye, or I'm not just working on your
Yes.
elbow, but hey, there's a whole person
Yes.
here. What a novel idea.
Exactly.
So you mentioned acupuncture. So what are some of the benefits about sticking needles into your body?
Yes, and that's a great question. And acupuncture, I think, is getting more attention now because we've had some wonderful more high visibility, I should say, support of the practice. The American College of Physicians, the ACP, recently recognized that chronic pain, low back pain, should be first addressed with non-medication efforts, such as acupuncture,
Great.
chiropractic care, and so it's a very exciting moment for us because we have understood that for some time now, but getting it to be more mainstream has been a challenge, even though the data is there.
Yeah.
And that's why we have acupuncture in our clinic, because there is very strong scientific evidence supporting its use for a multitude of conditions. In fact, the WHO has recognized several diseases and conditions for which acupuncture through controlled trials has been shown to be beneficial. That includes sciatica, headache, gastritis, hot flashes, temporomandibular dysfunction, TMJ, so many conditions that we can first use acupuncture to treat before we look at pain medication.
That's great, yeah.
Yes, very valuable.
And, we've talked a little bit about energy and, how that kind of benefits. But there's this whole thing about mind-body connection. What is that all about?
Yes. I always give the example of when some people experience an acute moment of stress, and then they have GI disturbance. So they've got to run to the restroom.
My stomach's upset.
Exactly,
Yeah.
exactly. So a lot of people have experienced that, but we never really clearly explain that that is one example of the mind-body connection. Your thoughts, your emotions are literally driving the function of the body. And so that goes
so much
beyond,
sense.
yes, really, I love it. The stuff is so interesting to me. And now we have functional MRI studies to show how a thought can light up those centers in the brain as if the experience was actually happening. And that's a lot of the premise behind mind-body practices such as guided meditation, clinical hypnosis, mindfulness. These are things that we can teach our patients to utilize and draw on when they find themselves in difficult situations, stressful situations, or just to cope with life, because those stressors will not stop.
Right.
And there are ways to help calm your mind and change your perspective, even if you find yourself deep in the throes of these situations.
So it can be a stress management technique. It can also be a technique to help move yourself forward. Like, for example, I'm thinking with athletes when they're told to visualize the end result before they've even been on the track or been on the field. They visualize themselves being successful, and their mind and their body, they don't know the difference, right? So it's a success, whether you've actually physically done it or not.
Yes, that's a perfect example.
Awesome. Well, I'm a big fan of massage too. You've got massage there too.
Yes.
So what are some of the benefits of having massage therapy?
So one of the great ways that we utilize massage is we use it within the treatment plan. So if I see a patient first, I can recognize when their symptoms may be due to a musculoskeletal issue. And before I would send them for X-ray or MRI, because they don't have any red flag symptoms, we have the time and the opportunity to really understand the diagnosis better before we jump to those things. I would recommend and actually discuss with our massage therapist some interventions that she could utilize to help alleviate the condition. One great example is numbness and tingling of the hands, which a lot of people are getting diagnoses of carpal tunnel to explain those symptoms. But what we have found is that there can be trigger points or very tight areas of muscle tissue that develop from overuse, from injury. These trigger points can be in the anterior neck, and they can actually be causing the symptoms of numbness, tingling in the hands.
So something up here can be affected down here.
Yes.
It's all one body,
exactly.
Right?
And so we can intervene with a massage intervention first and see if the symptoms improve. Otherwise, the patient will be on the path of nerve conduction studies and possibly even surgery. And we know that carpal tunnel surgery is not always successful, and my belief is because it was not the correct diagnosis.
Yeah. So you've got all of these wonderful things under one roof, and the last thing I want to ask you about is manual lymphatic drainage massage, because I've actually had some of that done to myself, and it was amazing how much better I felt just after one treatment.
Absolutely. I think this is a very undervalued aspect of massage therapy. We see MLD for short. We see MLD in, for example, patients who have malignancy, cancer. One very classic example is they've had a patient who's had breast cancer who's had lymph nodes removed, and they develop lymphedema or swelling in the arm of where the lymph nodes were removed from. They usually can use a sleeve that is supposed to provide some gentle compression to help prevent the fluid from pooling, because what happens is the lymph nodes normally filter the lymph fluid that courses through them. When you remove the node, that fluid can back up. So the sleeve is supposed to help. I think it's better than nothing, but manual drainage of that area has such a better response and so much more effective. And patients don't need it forever. They can, eventually trail off, where they may just need it once every few months. But the function that it provides in that arm, for example, the pain that it alleviates, it's just such a great and simple but effective intervention that I wish more people could connect with it, because I've seen the benefits. And even after any type of surgery in general, to promote wound healing, this type of therapy has shown great promise.
Wow. Well, Dr. Aman, it's been so amazing to have you here.
Thank you.
Let the audience know how they can find you, how they can investigate all of your wonderful services that you provide.
Absolutely. Our website is very comprehensive. It has a lot of information for people who'd like to know more, and that address is www.therestorecenter.com. We're also on Facebook, and we're located in West Plano near Willow Bend Mall, and our phone number is 214-396-0500.
Thank you, Dr. Aman.
Thank
it's
you,
been great
Claire.
to have you here.
I love being here. Thank you so much.
You're welcome. So today we're going to play a game called One Word Story, and this story is going to be told one word at a time. And assisting me today, I have Shelby, Ruthie, Dr. Aman, and Ellen. So from our studio audience, we need to have a suggestion of a story that has never been told before. This could be a person, a place, or thing. Let's have a noun, a verb. Chickens. And what are the chickens doing? What's that?
Chickens in space.
Chickens in space. All right. So, players, are we ready?
Yes.
All right.
One
Day.
bear,
Came.
a chicken,
That
was
Smart.
period. He
was
very
Intelligent.
Which help
Him.
in
Finding.
a sporting
Event.
that
He.
loved. Period. Which
He.
decided
To.
go to
And.
attend
The.
event. Period. When
He.
went
To.
the event,
He.
discovered
Space.
it was
Amazing.
and
So.
lovely that
He.
wanted
Nothing.
more than
To.
live.
There.
So he
Jumped.
into
A.
kangaroo and
Went.
into
The.
space.
The end. Good job, ladies. All right. Woo, woo.
Thank you for having me, Claire. This is cool.
You bet.
Yeah.
So my first question is, we are all so busy. How do you balance fun with responsibility at work?
Fun and responsibility. So when you
Yes.
own a company, you have a lot of responsibilities. So I try to do the responsibilities that I enjoy doing, and then delegate everything else
There you
out.
go. Delegation.
Yeah. Yep.
So what are some of the fun things about growing your business?
I think doing things with other people. So I call it audience hacking. But when you're working with other people, find people that have the same ideal customer that you're working with, and do things together.
Oh, okay.
I think so.
All right, so collaboration.
Yeah, absolutely.
Awesome. So how do you encourage others in their life to have fun?
So my fitness company, the kind of the tagline is work out with your friends for free, pay if you screw up.
Oh,
So,
Okay.
so I try to make it fun. You know?
from the very beginning there. So what advice could you give someone that might be struggling right now as to how to keep it fun?
How to keep it fun. I think doing things with other people and do things that make you nervous. Like, I'm nervous being here, but dive into the things that like ignite your heart and that shake you up.
Get that adrenaline
yeah,
going.
like I'm shaking right now. This is good.
Awesome.
Yeah.
Well, tell us a little bit about your business.
Yeah. So the Village Push, gosh, man, I started in about 2012.
Okay.
I had this idea to really help people, but I wanted it to be about something more than just like getting fit and like being strong, but like how to do something that like had a big mission to it. So like I tag nonprofits and fitness companies together.
Oh.
Yeah.
Wow. Okay.
Yeah, it's pretty cool.
All right, Josh. So if you had a happy dance or a happy stance, what would that look like?
I think it's like this leg shaking, or this leg shaking.
Kind of like Elvis?
Yeah, I think so.
Okay,
I think that's
awesome.
what I have.
So remember, thinking differently creates ingenuity. And I challenge you to be ingenious this week. Think about some things that you've been pondering about that maybe is a bit of a challenge, and look at it from 3 or 4 different angles. Let us know how that's working for you on our Coffee with Claire Facebook page. And remember, as always, follow the fun. See you next time.